A very good afternoon, viewers, and welcome to another special episode of Special Features from EDSU TV, an interactive talk show where we discuss with brilliant minds in diverse fields of knowledge. I'm Henry Kutukwa. Thanks for joining us. On today's episode, we have a very special guest here for the 2022-2023 Batch B induction and oath-taking ceremony of medicine and surgery graduates of Edo State University, Zaire. He is the Commissioner for Health, Dr. Samuel Ali, and also with me is the Commissioner for Education, Dr. Joan Oviawe, and also Dr. Kolawole Victor, representing the Registrar of Medical and Dental Council of Nigeria. Welcome to the studio. Welcome, sir.
Thank you, Henry.
I'd like to begin with you, Ma, to dive into the program. I'm very sure you've been given a tour around the school, the infrastructure, environment. Can you let us know your impression of the university?
I am actually quite impressed. It's a beautiful university community. I love what has been done. I'm particularly elated to see the quality of the maintenance culture. So it's one thing to build, it's another thing to maintain. And on this note, I really do want to appreciate the Vice Chancellor, Professor Aguiyo. I'm very keen on details. And I noticed as he gave us a tour around your university campus that even the new buildings now are being built to fit aesthetically with the existing structure of the school. So that as Commissioner of Education and being at the forefront of pushing our tertiary institutions to have a master plan and maintain that master plan, I'm very, very happy to see, I'm very, very happy with what I've seen. And pleased by the level of progress since when the school started in 2016 and now. And I think this can be attributed to the leadership of the school, the Vice Chancellor and his team. And also I want to acknowledge His Excellency, Governor Obaseki. I believe that, as is often said, one of the curses of democracy in Nigeria is a lack of continuity between one administration and the next. So where you have a previous administration building this university and a subsequent administration continuing to move the university forward along the vision of the founder and even taking it beyond that is something that is very exciting to me. I'm looking forward to what subsequent years hold for this institution. The students should be very excited and privileged to be attending such a fine institution.
Thank you very much, ma'am. Coming to you, Commissioner for Health, sir. What's your impression of the institution?
Very fine, very beautiful. In terms of layout, well laid out. It's passed for any university campus anywhere in the world. And I think it's a very conducive atmosphere for learning. I wish this was the kind of university that I also attended. But it's good that even if we did not have the opportunity to have this level of university medical education in my time, it's good to see that the subsequent generations have that this kind of privilege. I've been here before, and this is my second time being at the campus, and I can see that there has not been difference. So I'm not seeing evidence of wear and tear. That's what I mean. But I'm seeing a lot of infrastructural upgrade, development and upgrade going on. So that's good. It gives an environment where students can learn optimally, and they will turn out quality graduates, which is quality medical education, quality graduates. And that is what we all aim for. And that's the goal, actually, to be able to bring in something that is better than what you yourself has passed through. We must commend the Vice Chancellor, the Provost, and everyone who has, the Vice Chancellor especially, is a performer, like I said earlier, is a performer, is a man who has a vision for excellence, and it's showing in every aspect of the university. We must also give credit to the governor for also, because he appointed VC, that means his choice is right, and then providing the needed support effort to ensure that the university, the state university, that becomes the model for others and a platform for others to excel in their chosen endeavors.
As in the implies world class. Please, I would like to have your impression of the institution.
Yeah, thank you very much, Henry. The two previous speakers have said it all, but I would say that during the induction, I had the slogan, EdSU student, world class,
Yes.
and then taking the tour, I've seen that it's world class. Driving into the university, I was amazed, by the ambience, by the structure, and I would say the quality of infrastructure that I've seen is world class, it's standard, and for them to replicate it all across, in terms of the quality, the color mix, it shows that there's a plan, and they're working with that plan. So I want to appreciate those who envisioned this, the current government led by His Excellency Governor Baseki, the Vice Chancellor and his team. I can see they're doing a great job. And then for the medical training, I see that they actually have world-class facilities to train, the students. Like the Honorable Commissioner said, he's my classmate. We wish we had such to train with, and this is very good. So it's a model, it's an example of what should happen or should have in our institutions. And for medical training, to train our doctors, it's world class. And I think if the government can do more in bringing the enlightenment of the public to what they have here, I think we'll have more students coming. I think there should be some media hype about it. It's quite low. If I didn't come around, I wouldn't know that this exists. So it's actually a beautiful thing. I want to thank the people of Edo State for doing this.
Just to add to him that another day classmate, I was his class rep.
Yeah.
I'd like to come back to you, Commissioner for Education. There is a popular saying that knowledge is power, and education is the key to access that power. But that doesn't stop there, it has to be renewed constantly. Now, this is my question. What do you think is the difference between the old system of education and modern day compared together?
I think the difference is, if I use one word, relevancy, right? And in this hyper-modern age, in this age of high technology, we're talking about AI, in our country, we are still trying to get on the bandwagon of the third industrial revolution, and in some parts of the world, they're already on the fifth industrial revolution. So it's like, the world of artificial intelligence. So certainly, education cannot be what it used to be. As they say, innovate or die. So if you don't innovate, then you're going to become redundant very soon. Which is why I'm also quite happy to hear that your school is one of only 2 schools in Nigeria that has adopted or is implementing the competency-based pedagogy. So that tells me that by the time you and your colleagues are graduating from this school, you would have been outfitted with the requisite skills and ability to be able to function and to compete globally. So your slogan of world class is not just empty sloganeering. It's everything from the infrastructure, from the courses, from the laboratories, from the general environment, is positioning you people to be truly world class. And I think that a lot has been done. I'm sure the VC will say there's still more to be done and more support required to even further entrench your university into current cutting-edge technology.
Thank you very much.
Thank you.
Dr. Samuel, there's also a popular saying about health, that health is wealth. What are the government's plans to enhance healthcare services in Edo State?
Well, the governor, Governor Baseki, is one of the priority sector he has faced in the health sector. And just for me to roll it through, first we have to provide access, because Edo State citizens have one of the highest out-of-pocket payments before now, 90%. And that's encouraged quickly, that encouraged a lot of, it put a lot of body and stress. So the first thing is the health insurance, which everyone in Edo State should be part of, costing just 18,000 per annum. So with that, we have an access, and when it gives you not just for you to be able to access the facilities of the government, but also of the private sector. Then the next thing is we are modernizing our primary healthcare system. Before now, it's only general hospital people are used to, but we are making sure that we renovate, re-equip, and also train and properly manned primary healthcare centers. We have been able to renovate over 50 in that regard. Recently, I think 2 weeks ago, I and the governor was at Upenu in Ekoma to launch the telemedicine facility in a primary healthcare center. So we are the only one in the state that have a telemedicine capability in our primary healthcare level. And that is the way we want to. We're not just going to stop at the 3 we have now, 2 in Naredo and 1 there, but we want to make sure that before this year end, at least the target is to have 40 of that running in the different senatorial districts, so that we can bridge this human resource gap. It's helping us to also bridge the human resource gap in all that. So again, from the primary healthcare centers, we are also making sure that we have the tertiary at the referral facilities. We have one at Edo Teaching Hospital, which is affiliated to the university. That's in the north, and then in the south we already have one Edo specialist. Then we are renovating the Stella Obasanjo Hospital to world-class standard. Then in the central, we already have the Ruak, which is federal government, but we're also looking at upgrading Urumi to a special status, so that in every senatorial district we have a referral center, which American students, when they graduate as doctors, they can go there and actually live. The Stella Obasanjo is going to be more like where everything can be done in terms of whether tertiary or quaternary services. So all of these are what we are putting in place. But also we are doing something regulation. We are making sure that currently we have put into our portal over 7,000 facilities, both private and into our portal. And our target is to ensure that we register almost every facility here, and to make sure not only to register them, but ensure that they meet standard of regulation and to eliminate quackery. So we are strengthening our healthcare system, both in terms of infrastructure and also in terms of the manpower. This is what we are doing to ensure that the Edo State citizens get the best.
Thank you very much, sir. That's a really good initiative from the ministry and also the government. Thank you for honoring us and being with us in the studio. Thank you, Commissioner for Health, Commissioner for Education, and also Dr. Victor. We appreciate you all for being here. So our viewers, that is all we can take on today's episode of Special Features. Join us next time for another interesting episode. Follow our social media handles on YouTube at ETSUTV, on Instagram at PeakFM 90.5, and on Facebook at PeakFM 90.5 Edo State University Campus Radio. You can also email us at etsutv90.5@gmail.com. I'm Henry Kutukwa. Bye for now.